All right, so I got some more questions. I'm going to try to answer them to the best of my knowledge. Ton Photo Diary, I'm probably saying that wrong, is wondering about mouth care on someone with no teeth. And I believe they also said how to do this on a person with no teeth who also has dementia, that you're worried about swallowing the mouthwash or whatever it may be. Of course, as you know, if you intake a bunch of fluoride, it can be hazardous to your health. So, I believe that Mr. Ton Photo Diary is in Canada. If some things you may need to look up on your board of directors. However, a little trick I learned a long time ago is you take your rag, just a normal washcloth. Of course, make it a clean one. Take a clean washcloth and take you, with a gloved hand, take your mouthwash and soak your washcloth with the mouthwash. And if you're not worried about this individual biting you, you can do it this way. You get them to open their mouth and you rub their gums and the top of their mouth. I forgot the name of that right at the moment. And ta-da, you've done mouth care on an individual with dementia that you're worried about. Now, if this individual is going to bite you, you got to always look out for your health. You don't want to be bit. That's not going to happen. I mean getting bit. No, I don't like getting bit. If you're worried about getting bit, they make these sponges on a stick. I've also forgotten the name of them. You take these sponges on a stick and you compress the sponge and let it soak up the mouthwash. And you scrub, like a toothbrush, the inside of the individual's mouth. Now, you may not be able to do the washcloth trick according to your rules and regulations. You may have to use a device specifically for mouth care. These little sponge on a stick, they are specifically designated for oral care. I've forgotten the name of them. I think we call them like toothettes or something like that. It's been a while since I've used one, yeah, get a hold of these toothettes. It's a sponge on a stick, and you just soak that thing in. The best way I found to do it is get you a cup, like a styrofoam cup or a Dixie cup or a Solo cup, whatever you have on hand, and smash that sponge in there and just let it soak up all that mouthwash, and you just scrub them real good. You may, depending on how long it's been since they've done mouth care, you may pull out some gross gunk. But my favorite way is actually the way with the rag, and I'll use my thumb and I'll get up in there with my thumb. I feel like I have more control over where the pressure is with the rag and my thumb. But if you can't do that, of course, use the toothette or the stick with a sponge on the end of it. Also, a patient, another question was, a patient is constantly refusing care. What do you do? They're constantly mean, constantly rude, always refusing care. You got a couple different things here, excuse me, going on. Number one, and this is always where my mind goes as a man, as a male nurse, and I was a male CNA also. Number one, has this patient ever had any sort of abuse or anything? Because if they've ever had any sort of, maybe like a son or an individual like that, once you find out the backstory as to, and like I said, if you're a male, why this individual is maybe possibly scared of men. It happens a lot more than what you think. Elder abuse is quite prevalent. and it's very possible that it was a man that did it to them, and they may be scared of men. So number one, get you a backstory on this individual. Say, hey, patient XYZ in room 123 is constantly mean and refusing care. And then, your charge nurse or your director or whatever may say, oh, well, Chris, we forgot to tell you or whatever, 123 in room ABC, they were, they came in here with black eyes and busted noses, and they said that their nephew had done it. They're like, oh, great, so they're probably scared of men. That may not be the case, but it has actually been the case in my personal experience before. I've had patients scared of men nurses for that specific reason, for the reason of being beaten by a man. Another reason, a lot of these people, especially if you're in a nursing home, are demented, and you don't know how they're taking you coming into their room. You don't know if maybe it's your colors. I've done a video on how your colors present yourself, your demeanor, your voice, your accent. I run into that one quite a bit. You don't know how that's kind of twisting them. They may say, ooh, Chris, I hate that accent. I can't stand you. However, I've got dementia, and I can't tell you that I don't like the way you talk. I'm just going to yell at you. So get you a little bit of a backstory on this individual, especially if you see them quite often. And I assume if they're constantly refusing care, then that's what's going on. So get you a little bit of a backstory. Find out if there's anything in this person's past as to why they may or may not be refusing care from just you. And they may be refusing care from everybody. They may just hate everybody. They may be mad at their living situation, or whatever it may be. That's a possibility. You never know. People come into these things and they're scared and they're nervous and they want to be home. They don't want to be there, and they're just taking it out on you. So if a patient's constantly refusing care, always document it. Notify your charge nurse, your team lead, your director, the person above you. Notify them. Say, hey, ABC in room 123 is constantly refusing care. Look, I'll show you where I've documented it. Here's all my notes. Here's all my charting. I'm sorry, charge nurse Chris. I'm sorry. This is what I've got going on with this individual. I've done my best, but they just keep refusing care. And your charge nurse may say something like, thank you for doing your best, or, this has been going on for a while. They've always refused care. Or, like I said, they may say, oh, I forgot to tell you, they don't like men. Whatever it may be. So just document it and notify somebody. Don't make it look like you didn't do anything or you didn't try. So, hope it helps. Thank you much.